Welcome back to This Week. Following 2 years of talks with the federal government, Governor Haslam secured a deal to use Medicaid expansion money to buy health insurance for nearly 300,000 uninsured Tennesseans. And while his message fell on deaf ears this week, he tried to sell that plan to state lawmakers.
There is no subject that is more important to us than addressing the critical condition of health care. Issues surrounding health care are complex, and the politics can seem difficult. But there are few challenges that face our state that are as great as those presented by a broken health care system. I just don't believe that we can sit back and do nothing. In March of 2013, almost 2 years ago, I came to this chamber to tell you that Tennessee would not expand our Medicaid program. Expanding a broken program didn't make sense then, and it doesn't make sense now. But I also didn't think that flat out saying no to accepting federal dollars that Tennesseans are paying for, that are going to other states and that could cover more Tennesseans who truly need our help, I didn't think that made sense either. So we started to work to find a third way, a Tennessee plan. A plan that would leverage those federal dollars to really begin the work of fixing what is wrong with our health care system, to better align the incentives for providers and consumers. Now, regardless of where you are on the political spectrum, I think everyone agrees that our current system of health care does not work. It doesn't work in two ways: access or cost. First, too many of our citizens don't have access to medical care that really need it. Secondly, everyone should realize that we have to do something to address the out-of-control health care costs. My problem with Obamacare is that they took on one of those issues, providing more access to health care for folks without insurance coverage, but they did nothing to address the issues around the cost for health care. That was wrong then, and it's wrong now. After nearly 2 years of hard work, we have a Tennessee-specific plan that addresses health outcomes and cost. This is not Obamacare. If it was, it wouldn't have taken us this long to negotiate, and I could have saved a lot of trips to Washington and a whole lot of phone calls. We've done just what you asked us to do 2 years ago and what we said we would do. We found a unique Tennessee solution. Insure Tennessee is a 2-year pilot program that will not create any new taxes for Tennesseans and will not add any state cost to the budget. Once the 100% federal match is lowered to its eventual 90%, the Tennessee Hospital Association has committed that the industry will cover any additional cost to the state. The program will automatically terminate in the event that either federal funding or support from the hospital changes in any way. I know and fully appreciate that for many, the easiest thing to do is to say, this is Obamacare and I want nothing to do with it. But I would ask all of you to look past the easy political argument and do what Tennesseans have always done. Come up with an answer, come up with a plan that addresses Tennesseans' needs and do it in a fiscally responsible way. Like you, I didn't come to state government just to make a point. I came to make a difference. We have a chance to make a difference that will improve the lives of hundreds of thousands of Tennesseans, and at the same time to begin attacking the out-of-control health care costs that have driven our state and our country for too long.
And stay with us. This Week continues in a moment.